Thank you for joining us today. As you may already know, especially if you joined us for one of our previous webinars in the series, the foundational concept of humaculture philosophy is feed the soil, not the plant. The most successfully sustained organizations are those focused, whether intentionally or not, on cultivating an enriching workplace where people thrive. Those focused on people, paying the highest wages, or attempting to compete by having the richest or latest fad benefits, often encounter extremely difficult stretches when they suddenly realize they must refocus their attention on the bottom line. In fact, it is easy for organizations to be reactive and become distracted by all sorts of things that seem to be the most important at any given time. As in the prior webinars in this series, today's presentation helps organizations identify ways to stay focused in spite of, or perhaps because of, things that might otherwise be distractions or impediments on the path to success. We believe the best response to the No Surprises Act is through an approach that combines strategy and compliance. This approach will also help improve the perceived and actual value of your organization's health coverage, contributing to the fertile soil you seek to cultivate. Let me introduce our speakers. I'm Steve Cyboran. I'm an actuary and have over 3 decades of experience in HR, benefits, and total rewards. I've conducted research and take a behavioral approach to all reward programs. Wes Rogers is our Humaculturist. He combines his more than 35 years of business and leadership experiences, as well as the research and case studies from my past, to conceptualize the organization through the horticulture metaphor and apply its principles through the 7 dimensions of humaculture. Scott McKibbin is our pharmacy consultant. He brings very deep pharmacy experience working with plan sponsors, PBMs, and manufacturers around the world to manage all aspects of pharmaceuticals, including running a state's $2 billion pharmacy budget. Jack Towarnicky is our strategy and compliance consultant. He's a lawyer with decades of experience. He's a pioneer of several benefit innovations and has frequently testified in front of the Department of Labor around various HR and benefit issues. Let me introduce our first poll today. Please respond with which pharmacy management strategies you've employed. Please select all that apply and make sure you hit submit after you've completed the poll. All right, it looks like we've gotten, more people are responding. All right, I'm going to close the poll and share the results. All right, it looks like a good number of these strategies have been employed, with adoption of the acquisition cost-based pricing, the least common, with formulary and other limits on orphan and other high-cost RX second. Thank you very much. Now I'll turn it over to Wes. Wes, can you tell us a little more about humaculture and how it is important in today's topic?
Sure, thank you, Steve. In each of our webinars, we emphasize a different aspect of the humaculture philosophy and approach. Humaculture is a dynamic paradigm through which to understand, form, and optimize organizations, providing a holistic framework in which to make all decisions. Humaculture borrows many of its insights from the field of horticulture. Horticulture provides a keen metaphor to understand the organization and its purpose to attract, engage, grow, retain, sustain, and transition the people who interact with it. A good horticulturist understands that the success and sustainability of a garden or landscape depends on recognizing and balancing the climate and or the terrain, the soil structure itself, the available space and fertility of the soil or the growing medium, the arrangement and diversity of the plantings, the specific plants chosen and their characteristics, the conditions to optimize the availability and absorption of nutrients, and finally, the desired harvest or value to be derived from that created garden or landscape. Each of these 7 dimensions dynamically influences all the others. When considered and understood together, they guide the horticulturist's decisions in any aspect of garden creation, maintenance, or change. Similarly, humaculture is the art and philosophy of creating profitable, healthy organizations conceptualized as soil in which people thrive. Humaculture forms the basis for a systematic approach to making all decisions of a business or organization in the context of the 7 dimensions of humaculture. Our webinar today is focused on strategic responses to an aspect of one of the 7 dimensions, rewards. The humaculture philosophy, though, guides all our work, even when we are engaged selectively on narrowly focused aspects of the organization, such as, again, today, aspects of benefits or rewards, and how to assure that they provide the optimal access to the nutrients that will improve and sustain the employee's resiliency. We always strive to help organizations understand how any aspect of our work can be understood in the broader context of the 7 dimensions of humaculture. Merely complying with the No Surprises Act and the transparency rules is expected to only increase costs for both employer and employee. Our last 2 webinars in this series discussed how a strategic response to compliance requirements can create a competitive advantage, result in savings for employee and employer, and potentially increase consumerism and employee health and well-being. Today, we focus on a quote-unquote dope response to the CAA and transparency rules that impact pharmacy benefits. The CAA and transparency rules are intended to require a new level of transparency. The term transparency here, however, may be a misnomer, or at least probably overly optimistic. Even when the reporting and transparency requirements are effective, much of pharmacy will likely remain hidden behind a rather opaque veil. So employers face a conundrum. They must comply, but mere compliance will likely only increase costs, administration, and potentially litigation risk. Our goal today is to share some ways employers can proactively create a strategic response to address pharmacy benefits. The goal is not only to address costs, but create the best conditions under which plan participants can make the best decisions, most responsible use of the nutrients available through the pharmacy benefits. For example, when offered as a part of a complete strategy, acquisition cost-based pricing is a powerful tool to help create true transparency and re-involve the patient in the buying decision. Scott, can you tell us a little bit about the real pharmacy challenges we all face and shed some light on why these new rules are not likely to increase real transparency or help reduce pharmacy costs?
Thank you, Weston, and sure, let's talk about that. So, will these new rules and reporting requirements really make any difference? Will compliance lead to lower drug costs? Or will the reality be that drug costs will only continue to increase? As you said, pharmacy is the least understood and arguably the most opaque component of healthcare or healthcare financing. It is consistently and constantly changing. New drugs, way to repackage or rebrand old drugs, new gimmicks for the point for sale and financing of the drugs, and other mechanisms that are primarily intended to maximize the revenue and profits for the manufacturers and the pharmacy benefit managers, the so-called middlemen. Today in the pharmaceutical industry, we find ourselves in a situation where the tail is wagging the dog. Over-the-counter treatments may be as effective as prescription drugs, yet the pharmaceutical lobby, the strongest in the United States, by the way, influences the legislative process to ensure prescription drugs are favored over alternatives that might be equally or even more effective. Direct-to-consumer advertising keeps the demand for expensive drugs high among consumers. As a result, the drug prices in the United States are 3 to 10 times higher than most other industrialized nations, which is why reimportation, the discussion about reimportation has become a hot topic in recent days. And these issues are just the tip of the iceberg. Most people don't understand how PBMs make money. Are PBMs the problem? Or does the problem really lie with the pharmaceutical manufacturers? Or is it both? Or some other factors to blame? It's interesting that the PBMs and the manufacturers keep pointing the finger at each other. It's not my fault, it's the other guys. On top of everything else, the consumers are largely insulated from the real cost of the drugs, based on plan designs, by the way. So consumers are not very involved in the decisions at the point of sale. This means we haven't created a very favorable condition for employees, some of the most important plants, quote unquote, in our organization to be able to absorb the best nutrients in the most efficient way. The pharmacy challenge is far too complex to be solved or even significantly improved by the new transparency rules. We will need to think more holistically and strategically about pharmacy benefits as an aspect of rewards. Jack, will you give us some briefing on how the new rules impact pharmacy benefits?
Thanks, Scott. Yeah, there really are some new pharmacy reporting requirements, and maybe at some future date, who knows when, we'll see the government disclosure of drug cost and utilization information. But hey, take a look at this list. Does that look familiar to you? As a plan sponsor or advisor, you've probably received comparable reports from your PBM for years, maybe even decades. And chances are that your own plan's data has been compared to the rest of the PBM's book of business. Perhaps the outcome of these new burdensome mandated reporting requirements will give you a broadened benchmark, something you can look at that you don't have today. So, what? How will that help? Importantly, the reporting requirement has always been delayed, or has already been delayed, excuse me, and given everything underway at the agencies, it may be delayed again. Seems like all of these reporting requirements and mandated disclosures get delayed from time to time. And then once it does take effect, the agencies must compile the data and publish them. You might get data 2023 or maybe 2024, perhaps in time for you to review for 2025 renewals and your PBM selection going forward. Importantly, because one plan's top 50 won't match everyone else's plan's top 50, the data is going to have some gaps and inconsistencies. Don't wait. Take strategic action now. The new information, whenever it comes, really won't add any significant new insight. It'll be backward looking, and whenever it is published, it's probably already going to be out of date. Next slide. Those reporting requirements are the major focus. Oh, we skipped one, did we?
As we saw in earlier webinars,
sorry.
As we saw in earlier webinars, overall health inflation has been unrelenting, and employees have been relatively insulated from overall cost increases. The inflation story is generally worse for prescription drugs, and employees have been even more insulated from the cost increases of prescription drugs. As with overall healthcare inflation, prescription drug cost increases have been at least as rapid, if not accelerated, since the provisions of the health reform kicked in around 2014. It is also interesting to note that in 1970, consumers paid for about 85% of the total prescription drug costs, While today consumers pay for only about 13% of the total cost of prescription drugs, consumers have been almost completely removed from the purchasing decision. Jack, do you want to talk a little bit about the decisions that employers need to make?
Sure. So the important thing about compliance is, of course, that it's not optional. You're going to have to do the reporting and the other stuff that's part of the No Surprises Act and the transparency rules and the Consolidated Appropriations Act. But that's only one of two roads. The other is a strategic response. A strategic response is needed to avoid continuation of the status quo, and it's trends in pharmacy that Steve just shared in terms of pricing and cost sharing. We agree with Hall of Famer baseball player Yogi Berra, when you come to a fork in the road, take it. Reporting alone will only add to your costs. Instead of a compliance-only response, coupling it with strategic changes in pharmacy benefits can help to improve your benefit plan in terms of costs and your workers' perceptions of value. Scott?
So, as Jack said, even if it's delayed again, all pharmacy benefit plan sponsors will be straddled with these new compliance requirements at some point. We really don't expect the new rules to make a positive impact, and in fact, expect the cost of medications to continue to rise. PBMs and drug manufacturers, once the data is publicly available, may find the marginal increase in transparency to be actually very helpful. They may learn that their prices are actually below the median, perhaps significantly so. So if you're a PBM or a drug manufacturer now armed with this knowledge, what would you do? Continue to charge less than your competition or your competitors? Or will you make a prudent business decision to raise your prices to a level that you know the market is currently able to pay? Even if there is some improvement in cost transparency, the new rules will likely do little to increase overall transparency because the pharmacy challenge is far too complex. But we believe true transparency at the point of purchase will make a difference. But to be effective, even true transparency must be part of a broader strategic response. Better administration of the pharmacy benefit is the kernel of an effective strategy, a dope response if you want to use the current Urban Dictionary vernacular. Effective, transparent pharmacy benefit management includes three components as well as the right tools to do the job. People are empowered when their pharmacy benefits are delivered through the, number one, right administrative approach. Number two, have a plan designed to encourage and support the best choices. And are number three, educated to understand their choices and equipped with the right tools. This applies to all rewards and anything you do for your organization. This is just an example of how it can be done with pharmacy benefits. Our goal is to optimize the absorption of the appropriate nutrients available to your organization. Steve, do you want to talk about some of the design aspects from the behavioral perspective?
Sure. At a fundamental level, each organization needs to ask itself if spending more on prescription drugs helps or hurts the business. I know there has been some thinking that if you get people to be more compliant with their prescription drug regimen, it can result in better health and productivity. However, if you can achieve the same or better outcomes at a fraction of the cost, wouldn't that be better for the business as well as your employees? To accomplish better outcomes at lower cost, business should design benefits based on a couple of principles expressed by these questions. First, does any business want employees who sought it out because it provides the best prescription drug benefits? Is attracting such employees the best way to support the goals of the business? And second, Do you want employees who are fiscally responsible and accountable, or employees who want to be indemnified from all personal responsibility? If you agree that you don't want employees to join your organization to get the richest benefits and want to be indemnified from their personal choices, then your design shouldn't be overly generous and should help employees participate in and reap the rewards of the financial implications of their decisions. Scott?
So, what is acquisition cost-based pricing? It is acquisition cost-based pricing uses a database like the National Drug Acquisition Cost, also known as NADAC, published by the Centers for Medicaid and Medicare Services, or federal CMS, on Medicaid.gov to set prices for prescription drugs. The participating pharmacies are paid a dispensing fee added to the acquisition cost of the drug as established by the NADAC database. This is, by the way, similar to Medicare using RVRVS for pricing on outpatient services. This is a relatively new approach. At least one commercial PBM and some of the managed Medicaid plans, as well as Medicaid fee-for-service plans, are now using this approach. It's really the only way to achieve true transparency in pharmacy benefit administration. It's a published list, anybody can access it. Pharmacies generally prefer this type of pricing. They like it because it's predictable. As long as the dispensing fee is set appropriately, they're generally fine with it. Rebates generally are still paid on the back end after the fact and at least 1 quarter behind. Although we've talked about, ideally the rebate should be applied at the point of sale. Some administrators and PBMs are claiming to provide at least an approximate amount by drug at the point of sale. But it really doesn't look like this is going to fully happen unless the government requires it for Medicare Part C and Part D plans. And this has been under discussion for the last few years, by the way. The potential for cost protection really depends on several factors like spread pricing, MAC rates, AWP contracts, the type of benefit plan design, the level of employee education, and the tools available, especially for the employee at the point of purchase. So we need to educate these participants. And you see here some interesting information. Patients need to understand it's okay to ask questions about the treatment. In fact, it's critical. But patients are much less likely to ask questions if they're not educated about prescription drugs and how they relate to their own health care and well-being. A word about this chart. All brand and generic drugs are NADAC priced. There's one exception here that wasn't available. All pricing on this list is for 30 units, with the exception of the Clarinex D, which is 60 units. As you can see by this table, brand name drugs cost 100 times or more of their generic equivalent, and 400 times plus more of an over-the-counter alternative. Yet, brand drugs can be approved, by the way, by the FDA with only a 20% improvement over placebo. Right, so think about that. If placebo produces a 10% response rate, 20% more is all that's needed for a brand drug to be approved. Many over-the-counter treatments may be as effective at a small fraction of the price. An example you see on this at the top is Plavix. And I'm not trying to pick on this particular drug, but when you review the available data, you'll find that aspirin is about as effective. While I'm not trying to practice any medicine, the information is available to anybody who has access to the internet and to your covered patients. Even beyond any drug option, many conditions can be addressed through wellness alternatives and with much more of an enduring impact. An effective part of any DOPE response will include strong educational components for your employees. They must be armed with the information they need to ask questions of their healthcare provider, including their pharmacist. But beyond the questions, they need to know enough to ask the effective questions and to understand the answers they are receiving.
So in each of our webinars in this series, we share some insights into how to use behaviorally designed communications to help lead employees to better decisions. Effective, behaviorally designed communications will lead to employees, customers, shareholders, and others to make the best use of the fertile soil of your organization. Let's consider some aspects of effective behaviorally designed communications in our pharmacy example. Here are a few examples of heuristics from our library that can apply to your communications. First, use new laws and regulations as opportunities to engage participants based on meaningful cost and efficacy differences that impacts participant and plan costs. Second, leverage recent examples of extremely costly drugs to identify the need to save and make better purchase decisions. And as we discussed in our last session, get them to use the HSA as a mechanism to preserve the harvest by avoiding taxes. Third, understand that losses are felt 2.5 times more than gains, and ensure participants can easily identify the negatives so they can avoid them. Fourth, remove the status quo option. Like inertia, a person at rest tends to remain at rest. Remove the option to remain at rest. So it's time to educate, prepare, and encourage employees to become better decision makers, as well as fiscally responsible and take ownership of their health before they become patients. But not only their health, but be fiscally responsible and take care of the health of the organization and its resources as well. So our goal with our strategic compliance series is to help you understand why it is important to go beyond basic compliance. In our first 2 webinars, we offered a couple of suggestions on strategies that respond to the No Surprises Act and transparency and coverage rules. We think both can help plan sponsors cultivate a competitive advantage. Reference-based pricing is an example for how to avoid aspects of compliance while also reducing plan costs. Leveraging HSAs is an example for how rewards can be used to help avoid taxes and appeal to talent that is competent in making good decisions, fiscally responsible, and interested in taking ownership of their health. This webinar considered some dope responses to the pharmacy challenge. Pharmacy is far too complex for the new transparency rules to make much, if any, impact. Compliance alone will likely only increase costs. As we mentioned in our earlier webinars in the series, it is important to note that an advisor whose income is tied to a percentage of healthcare costs may be hesitant to help you with some of these more strategic course changes that can actually reduce costs. We will cover this in greater detail in our 5th webinar in May. We've developed a compliance toolkit, but we don't think mere compliance is enough. Our Humaculturist can help you comply, or we can help you comply and offer approaches that may enhance your participant experience with health coverage without increasing participant or plan costs. A dual approach will ensure you minimize the compliance challenge as well as create competitive advantages to attract, engage, grow, retain, sustain, and transition the talent you seek and make the organization more financially competitive. As we have said, the requirements of basic compliance is not the focus of this webinar series, but we have developed some great resources to support your basic compliance needs. This is our 3rd of our 5 sessions in our Hidden Opportunities webinar series. Our future sessions will expand upon our first 3 webinars and provide other illustrative examples of strategies you can employ to leverage the hidden opportunities to be found in the No Surprises Act and the transparency and coverage rules. We want to help you better manage your benefit programs and differentiate your employee value proposition to attract and support the talent that will best advance your company's business objectives. Next month, we will explore potential strategies related to mental health parity and strategies to go beyond compliance to actually improve the resiliency of your employees. Please make sure you register and participate. All right, now we will take a few questions. And as we said at the beginning, follow up with a written Q&A to be distributed to all participants in today's session. Let me look real quickly at our questions. Let me see here. Looking at the time, we probably have room for one of these questions, so I'm going to choose how does NAADAC pricing manage the high cost of specialty or orphan drugs? Scott, you want to take that?
Yeah, I mean, NAADAC is really not a drug management tool, but it's really a published list of drugs that are typically dispensed at a community pharmacy. It will have some gaps and must be filled in with other payment methods. So it's not really going to manage you know, NAADAC or any pricing will give you information about that, about how much those things cost, but by and of itself, it's not going to manage. You're really going to need some strategies, some tools, as Wes said earlier, to really tackle those super high cost, rare drugs and orphan drugs.
Well, thank you. Thank you for joining us today. We hope you find this helpful. We would love to hear from you, to learn more from you about your specific challenges or circumstances. Please remember to register for our remaining 2 sessions and complete the survey you will receive following the session. We value your feedback and it will help influence our future presentations and the content that we include. Thank you very much and have a great day.